tell me why you're here. We did the Botox.
We did. I've had a baby,
Yes.
and my stomach is just not the way that it was pre-baby.
How is your weight compared to before the baby?
Similar.
So, are you having another baby?
Not anytime soon.
If you're contemplating any kind of procedure, especially something like a tummy tuck, you don't want to do that if you're planning on having another baby.
Okay.
If you hadn't had a baby, I would say that you have great skin tone because you're young, and you would be a great candidate for liposuction. So liposuction is very good at removing central abdominal fat, especially for somebody who doesn't have any intra-abdominal fat. Okay, so if you can kind of pinch fat, that means that there is fat on the outside, and that fat can easily be removed with liposuction. But if you see, guys who have like a big beer belly, you can't really pinch any fat from the outside. All their fat is on the inside. So there's no surgery that can remove that except losing weight. Okay? So for most women, they carry their weight on the outside. So it's extra abdominal fat, and that fat can be accessed through surgery. If you have had a baby, then it's rare that just liposuction would be enough. And the reason is that skin gets stretched with pregnancy, and that stretched skin is still there. Even though a lot of it does contract in the first 6 months after having a baby, some of it does need to be removed. In your situation, if you wanted something done, probably liposuction would be great in addition with a mini tummy tuck. The other reason why people feel like their belly is stretched or not the same shape is that the muscles stretch. So the same way the skin stretches on the outside, the muscles stretch on the inside, especially the division in the middle is called a rectus diastasis, means that the distance between the six-pack muscle gets extended, and the abdomen just doesn't sit quite as flat as it used to. So, people come and they say, oh, I've been doing all these sit-ups and all these core exercises, but my belly is just not as flat as it used to be. And the reason is that those muscles have separated, and then there needs to be a tightening of the muscle layer as well. Now, you're very active,
Yes.
right? So really the catch with this surgery is how much downtime there is.
Right.
If somebody has just liposuction, usually maximum is of a week is all you need. Even the first 2 days after surgery are sore, but even after that you can potentially go back to work if you don't have a very active job. But if you end up having a tummy tuck, you have to be really, really careful with the recovery. So you really do need at least 2 to 3 weeks of complete rest where you're not doing anything for anybody else, and you're allowing all of that skin to stick back down and heal nice and flat. So I want you to really think about what we've said.
Okay.
And think about whether you have supports at home, somebody to take care of the little one, and make sure that your husband's supportive and all of those things. So don't jump into making the decision, and just remember that with any kind of surgery there are complications, and the complications go up if you don't rest. So whenever you decide which direction you want to go with the surgery, you need to come back, and then we need to go into what really is involved in detail with all of the surgeries.